Cuyahoga County Health, Human Services, and Aging Committee meeting is now called to order. Chrissy, would you please call the roll?
Calling the roll, Mr. Jones.
Here.
Ms. Conwell.
Here.
Ms. Brown. Ms. Brown is absent at the moment. Mr. Schron. Mr. Schron is absent. Mr. Miller.
Here.
We have a quorum.
Excellent. Chrissy, has anyone signed in for public comment related to the agenda?
No, Mr. Chair, no one has signed in.
And can we have an approval of our minutes from the September 7th meeting?
I'll move for approval. Second.
Moved and seconded. All in favor say aye.
Aye.
The minutes are approved. We have 3 items on our agenda today, and we have a presentation. What we'll do is we're going to take the first item, the resolution regarding AmeriCab transportation. Chrissy, if you would read that first item into the record.
Resolution 2016-0161, making an award and requisition number 36875 to AmeriCab Transportation in an amount not to exceed $8 million for Medicaid non-emergency transportation services for the period 9/1/2016 through 8/31/2018.
Director.
Good afternoon, David Meerman, Cuyahoga Job and Family Services. I'm here on behalf of our organization to present an award to AmeriCab Transportation Incorporation. I'm here with Patrick Keenan, who is the general manager of AmeriCab, as well as Walter Parfiowitz, who manages this service for us through the Health and Human Service Fiscal Office. This is not a new service. It's a service that we've provided for several years, and the dollar amount requested is consistent with the most recent period. This is approximately $4 million a year that we use to fund non-emergency medical transportation for recipients of Medicaid. So essentially 600 clients a month, or about 20,000 rides a month, are provided to the community. The principal services that clients are utilizing through this non-emergency transportation are radiology, chemotherapy, and methadone treatment. And it's obviously an essential medical service. We're grateful to be getting these dollars. These are pass-through dollars. They come straight through the state and to us from the federal government. And there is not a county commitment here. We also are very grateful to have this as a part of the program that supports the needs of individuals that are dealing with addiction. I think there's much knowledge and awareness about the opioid epidemic that is hitting America in Cuyahoga County. I think the fact that we can offer some individuals access to transportation to maintain their methadone treatment, to stay sober, is something that we're very proud of. As I also said, this is also a service that helps individuals without means to maintain radiology and irradiation and chemotherapy appointments. There were 2 bidders. One was disqualified as being non-responsive. So there was only one responsive bid that we reviewed. That's the bid that we're bringing forward to you. The services are effective the start of the month, and the contract has an option year that will extend to August 31st, 2018. Be happy to answer any questions you have on this item.
Okay. You mentioned 600 clients and how many trips?
20,000.
20,000 trips.
The way it works, clients call a number, they schedule an appointment. Each appointment is for a to and from ride.
Okay. Any questions from the committee? Councilwoman?
Would this, through the chair, would this contract include our children that we have in our custody as well? For
So
DCFS?
I don't believe, no, so this is not for unaccompanied minors to travel. That's not a service that we provide. I know that the CMSD, the school district, uses cabs to transfer children, but I don't believe we do any unaccompanied or any unaccompanied minor transportation.
So the children in our care, how do we get them to the hospital?
So ultimately, the foster family is responsible for it. We do have a transportation unit in the Department of Children and Family Services. Gets me off topic a little bit. That's something I'd be happy to get additional information for you on. But I can tell you the transportation unit primarily focuses on children getting to visits. but I can tell you there have been visits at doctor's appointments, there have been other visits. And so there's also a responsibility at the end of the day of every foster parent to make sure the child's needs are met. And if there's a specific medical need, it's that foster parent or that network's responsibility to address it.
All right, and then we have several cab companies in Cleveland. Did this go through a bidding process?
This did. This went through the Office of Procurement and Diversity's bidding process. By that I mean we did not manage the bid per se. OPD did, and so they released it to everyone on their list. They had it out for the full term, and it was a fully reviewed process.
Thank you.
So AmeriCab has won the award. Who had it previously?
AmeriCab.
AmeriCab had it previously. How long has this contract been in place? How long have they had the contract?
So that was the second term in which AmeriCab had it. This will make the third term. Prior to that, another cab company had it, and they weren't able to continue their service at the quality that we expected. I'm going to check with Walter Parfiowitz to make sure my numbers are correct in terms of the terms.
This new contract started at 9/1. It is now 9/21. Has there been any interruption in service?
There has been no interruption in service. The provider continues to take calls and place individuals. Or to transport individuals. We haven't been able to make payment. We did have this in the queue to come forward to council. Unfortunately, we did not anticipate the break in council schedule and the one meeting that did not get scheduled. Otherwise, I think we would have had this done by 9/1. Walter, can you speak to if this is the third time that AmeriCab has had the bid?
It is the third time. Previous, we had Ace Taxi. We wound up terminating the contract with Ace Taxi for non-performance.
Why don't you introduce yourself?
Oh, I'm sorry, Walter Parfiowitz, Health and Human Services.
Okay. What year was that?
I believe 2010.
Okay. And these are pass-through dollars from?
They're
the
federal
state-
Medicaid
federal-
dollars passed through the state of Ohio.
Has the dollar amount changed over the course of the contract, over at least the last three?
This contract is 8 million. Previous contract was 3.6 with the 4.4 amendment, primarily due to the methadone treatment.
So methadone has caused,
Methadone treatment requires 7 daily, 14 trips a week, 7 days a week. That's what caused the increase. Chemotherapy, radiation, and dialysis are on average 3 days a week or 6 trips per week. Methadone is 7 days a week or 14 trips. That's primarily the cause of the increase.
Chrissy, let the record reflect Councilman Brown is in attendance, and Councilman Miller, the floor is yours.
The $8 million, that's per year, is that correct?
It's $4 million per year. It's a 2-year contract.
Okay. And how much do we pay per ride?
We were paying $14.82 previous contract. This contract is $15.22 per ride.
And is it the same price regardless of the length of the ride?
Correct. Anywhere within the boundaries of Cuyahoga County.
So they figure it's going to average out?
Precisely.
Okay. And who was the other bidder? How much did they bid, and why were they non-responsive?
The other bidder was Emmanuel Ventures Limited. They bid $15 per one-way trip, non-responsive because they failed to produce a bid bond.
Okay.
Any further questions from the committee? Councilwoman?
And can you just enlighten me on the importance of the bid bond?
I'm sorry.
Can you just enlighten me what's the importance of the bid bond? I mean, is it something that we have to?
So I would say on this situation, we frequently don't request a bid bond on health and human service projects. Generally, these are health and human service organizations, but I think there was concern that if they defaulted on their proposal, that they had the ability to support the project. I think it's more of there's a legal question as to why we require bid bonds on any bid. I think this was a service that we felt especially serious about because people do count on this service every single day frequently. And we need a provider that can back their performance up with daily assurances. And so this is, again, it's not an emergency, but I still consider it an essential medical service. I don't know if I could ask the law department to talk a little bit about the bid bond process.
Because I don't see how those two correlate to the bid, to the purpose of the bid bond.
So our risk management department usually helps to determine whether a bid bond would be necessary. The bid bond ensures that the bidder is going to honor the bid that they put in. And so it's important. It can skew the process if they don't provide a bid bond because there's a cost to obtaining a bid bond. That, you know, if you could bid a lot lower by not providing one if you.
Well, my whole point with this is we asked for a bid bond that we didn't usually do in the past. So we have a company that we've used 3 terms already, and we are always trying to open up the doors for other people. So I just was trying to get the connection of why if we needed the bid bond, what does that have to do with the performance or us feeling that their performance of carrying out these duties was necessary?
We have always asked for a bid bond. We in fact used the bid bond when the previous provider was non-responsive, and it's an easy thing to say non-responsive, but at the end of the day, they weren't showing up to get people to medical appointments, and so it's a very big deal. It was a big deal for us to terminate their contract, and then we used the bid bond as a stopgap measure.
Okay.
So it does raise the significance of this service. But when people are expecting to get to chemotherapy or dialysis, I'm sorry, I neglected to mention dialysis is the other major service. That cab better be there.
And I don't know if you're understanding what I'm saying. That has nothing to do with, I know we need reliable transportation for the medical services that any of us could possibly have to do, and these things have to stay current and at the same time. I was just wondering about that bid bond because I had never heard about that, because I remember ACE being the provider when we first came on board. So I don't believe it was 2010. I believe it was actually 2011, and we were switching over to AmeriCab. So I remember that kind of conversation, and the term bid bond is kind of new to me, and I just wanted to make sure that if we're gonna do it, it's on a consistent basis, that anytime we bid out for this type of contract, that everybody, the bid bond is a component of that, and we're not just doing it for one and not somebody else. So maybe I misunderstood
No,
what you said.
I
Okay.
understand.
In this committee and council, we discussed obviously performance bonds. Just to bring terminology together, bid bond and performance bond are the same thing. Is that correct?
They're different, but they're related. So a bid bond ensures that the bidder is going to honor the bid that they put in. The performance bond ensures the actual performance under the contract. I believe in a lot of cases, the bid bond, you can convert it into a performance bond. So they're related. They're not exactly the same thing.
Performance bonds come to contractors from insurance companies and underwriters who provide it.
From sureties, yeah.
Do bid bonds work the same way?
Yes.
Okay. And now I'm just giving back to you what I've heard you say. We had a challenge with the previous cab company for failure to perform. And
That's
as
correct.
a result, the department determined we should incorporate a bid bond into our process. Is that when it started?
No, I understand that we had a bid bond with the previous provider as well. So we've used bid bonds for an extended period because this is a multi-million-dollar contract every year. And at the end of the day, we need assurance that they will have the vehicles, they will have the fleet management, they will have the ability to be where they need to be at a specific time. We ask for a bid bond. It's not something that I'm aware of us doing with, so if we have our next contract with Catholic Charities, I don't believe we use bid bonds in that situation. But this is much more of a basic need service.
I'm trying to still understand the mechanics of a bid bond. With the performance bond, if they fail to perform the task that was required, the money that we've given them, we get from the performance bond. With a bid bond, how and when is money exchanged?
And I'm no expert in bid bonds, but my understanding of it is that the bid bond ensures that the bid that was offered is going to work. If the bidder fails to be able to perform under the bid, then the bid bond would make up the difference between that and the next lowest bidder, so that the county wouldn't be out the money that it takes to get somebody else in.
To call the
Right.
to call the second. So in other words,
Right.
you would, there is no second bidder in this case, a manual. You only have
If
two.
if the bidder failed to perform this, we'd have to look at some sort of short-term stopgap solution and most likely rebid this.
The other aspect of performance bonds, I'm just gonna work with what I know, is if we have someone build a building or do rehab work of some type and they fail to perform it, then we receive that money from the bond. But there are certain instances like with supplies or maybe even this case, if someone does work and they haven't been paid yet, then the question is, did you need a performance bond? Here's my question. Do we pay this contractor before they do the work or after they do the work?
It's after.
When
They
you pay
invoice
them
us.
after. So if they fail to perform, why do you have to pay them? Or not why do you have to pay them? Why don't you use the money that you would have paid them to pay the next person?
So while there is no next person at this point, I think, a bid bond is, I'm hesitant to kind of speak to what position the bid bond gives the county if a provider defaults on their proposal. And so maybe I would ask the law department to describe that. When we procured this, we included the requirement of a bid bond with the expectation that there would be multiple vendors that apply. The fact that only 2 applied, does change that. However, it's a requirement. It's something we wrote into the contract. And, I think maybe it would be good if we did have multiple vendors, if we had a 2 and a 3. The fact that only one other bidder applied and the fact that they were disqualified is, I think our current state, but I think our intent was correct from the start.
So I guess what I want to get at is, are we taking the most effective approach? Does a bid bond, I don't know enough about them, if I come back to the point that we pay the person after, we pay the contractor after they do the service.
Yeah.
So we don't lose money as if we ask someone to build a building and they fail to perform. We've given them money up front. So since we still have the dollars, it makes me think there should at least be a little more conversation about, is the bid bond the most effective way to accomplish the goal of what we want to do? It may be.
Well, that would be related to the performance bond. So if you had a performance bond and they failed to perform, then it would pay, then the bond would pay. In this case, if this bidder then couldn't meet the bid that they put in, it would, I believe it would pay to the cost of our cost to rebid the project, or the difference in going to the next lowest, or I'm sorry, the next lowest bidder.
So we would be happy to look at a performance bond in the future for another project. I would also say that I still stand behind the use of a bid bond here because it did require the bidder to go out and to get a bond to assure their service. I don't know that there are many services that we provide that are more important than ensuring someone with dialysis get to dialysis or someone on methadone get to a methadone treatment. I mean, it is a very significant service. We expect our bidders to be able to secure a bond and to be able to stand behind their proposal and to understand that if they failed in the achievement of their proposal, that there would be consequences. This is not a situation where I in any way could view a minimal impact to disruption of the service. I think many people would be put in a very awkward position if they did not, if this provider failed. And, I think the bid bond gives us some assurance from the provider's perspective that they'll stand behind their proposal.
So again, I just come from the perspective of how do we keep contracts competitively bid by having as many contractors bid as possible. And I wonder, and I'm saying, not saying it is because I don't know enough about bid bonds. If the company didn't get the bid bond, I don't know if they have to pay money up front. Is it a gamble for them to get a contract, a bid bond, if they think they might not get the contract? And there's already a company who's been getting it year in and year out, and we pretty much know we want to go this route, and we're already late, but they're willing to do the service because they know they're getting the contract, and so probably offline, I'd probably like to have more of a conversation around bid bonds in general, and just to understand it a little better.
And I would also just encourage that offline conversation to be with OPD. This is a part of the reason we worked with them. This is different from most of the services that we tend to procure. And so we followed their guidance and they led the process.
Okay. All right, are there any further questions? Yes, Councilwoman.
And how many, how do you determine how many rides constitutes non-performance?
It's a good question. I'll have to look at the contract. I think I would start to be concerned when they missed more than one or two, but I understand that, car accidents happen or car doesn't turn over. So I know it happens, but it's a fair question. Sure, we could talk about the conditions that happened with Ace Taxi.
With Ace Taxi, that was still under the commissioner form of government. I believe it was in 2010. We had a woman who was scheduled for 3 days of dialysis, was not picked up for any 3, and wound up in intensive care. That was the primary reason that we terminated that contract.
Okay, so it was based on an actual incident that occurred. I get that. Can't nobody say nothing more passionate about, people's health and their care, but I'm putting that over here on another side. I'm just kind of with the chair here in the contracting and what we initially are trying to do with the county, open these contracts up for more vendors to be able to participate. And now there's something new in regards to bid bonds. So that would be my second question. When was the bid bonds instituted into these type of contracts? And I have the dates.
It's always been included in this
Just give me the date whenever the county, if it's
Okay.
1976, I just want to know about that. So I'm good with the people. I know the people should be served, and we want somebody there when we need them, but I know also accidents happen, things happen, so we want to just make a determination. This has nothing to do with the Meercab owners, to make sure that we have as many competitive bidders as we can so we can keep the cost down. Because when you kind of just start leaning toward a sole source, that cost can go up too. All right.
Councilman Brown.
Thank you, Mr. Chair. Essentially, my question was asked and answered by Councilwoman Conwell. I was hoping you would be able to identify the threshold of what, determines whether a company is non-performing or has failed to perform. So I don't know if that, if this conversation has brought that to the forefront, that perhaps that should be something we should detail in our future contracts, but I think it would be a fair and more transparent process if we did. So thank you.
Any further questions from the committee? If not, I'll make a motion that we. What did?
I stirred up the question about bid bonds.
I'll make a motion that we move this resolution to the full council. I assume you're asking for, or are you asking for?
We are asking for second reading suspension. I apologize for the delay. I can say this item went into the system well in advance of the deadlines, and I think the timing just didn't work out to have it introduced and enacted out quickly.
Okay. And I will support second reading suspension. I was in a committee, I guess a few days ago, and I supported second reading suspension simply because I believe people should be paid. I think there were some other reasons behind the contract and why it was delayed, but in principle, I believe we should try to pay people as quickly as possible. So, moved and seconded. All in favor, say aye.
Aye.
Aye. Thank you.
Thank you.
Are you still here for the next contract?
I am.
Okay, we'll get that in and then we'll get our presentation in. Chrissy, if you read the next item into the record.
Resolution 2016-0163, authorizing an amendment to contract number CE 1500128 with Catholic Charities Corporation for various services for Ohio Works First and Disability Financial Assistance recipients with barriers to employment for the period 7/1/2015 through 6/30/2016 to extend the time period to 6/30/2017 and for additional funds in the amount not to exceed $977,321.
Director.
Good afternoon, David Meerman, Kaga Job and Family Services. I'm here on behalf of the administration on a request to amend our contract with Catholic Charities and a service they've been providing the county for some time. You may recall that we had an item in front of the Board of Control recently amending our contract with Catholic Charities, adding $400,000 to it to provide intensive case management. There was a little bit of confusion between this item and that item. They went in around the same time. One was an amendment of one service. This is an amendment for a second service. So this item is delayed, and I take responsibility for that. I will say this about Catholic Charities. They've worked with us to look through an opportunity that we're in the midst of implementing. A program we're in the midst of implementing, and I'd like to take just a few minutes to describe our comprehensive case management and employment program and Catholic Charities' role within it. As council may recall, the county selected Kaga Job and Family Services to be the lead provider for the implementation of the Comprehensive Case Management and Employment Program, generally referred to as CCMEP. Apologies for the acronym. The county chose CJFS because we are providing many of the services that were presented in the CCMEP program by the state, and we felt it important to integrate this new state program with existing programs. When the state developed the Comprehensive Case Management Employment Program, it initially intended for that program to serve all cash assistance recipients, beginning with youth and then moving to older adults. During the legislative process for the 2016-2017 budget, the state plan was changed to focus solely on youth. We understand that most likely the administration will not let go of the vision to serve everyone through this new initiative, and in time, older adults will be included as well. We have provided a service with Catholic Charities for many years where they are a provider of intensive case management and pre-employment screening to our cash assistance recipients. Let me explain how this works. Catholic Charities is seated on site at the Virgil Brown Building. They have LISWs and social workers that are available. Every client coming through our door for a request for cash assistance, be it their first time or if they've left and come back, as well as for essentially a reassessment, is referred to Catholic Charities. Catholic Charities provides a pre-employment screening. They then refer the individual for programs. We design programs based on the input of that pre-employment screening. When we identify that a person has some significant barrier to employment, we refer them to Catholic Charities, who provides intensive case management to the individual to address the barrier to participation. That program has existed in this county under our own volition, under the leadership of Bob Math, for many years. We felt it important to address people's barriers so that they can take advantage of the time and the resources we have while they're in cash assistance. When the state developed and implemented this comprehensive case management employment program, we said this is something we already do. We already screen people, which is a key component of CCMEP, and we already provide intensive case management. And Catholic Charities does both for us now. And they do that for many of these same clients. So we made the decision to extend Catholic Charities' existing contract to allow them to provide this service and for us to take a year plus to figure out how this will work when we broaden it to the general population. It is a decision that was more practical than other options, But we felt that between the time that we had the decision made as to who the lead agency, which was May of this year, and implementation, which was July of this year, there would be no ability to do a procurement. So we chose the existing provider that was currently providing the same or a similar service to work with them to develop a new model. I'll commit to you that over the next year, we're going to design a procurement and we're going to rebid this. We're going to learn from this opportunity. We have made this status known to Catholic Charities. They've agreed to help us launch this program, but also understand that in the near future, we will rebid it. And a new provider will be given all providers will be given the opportunity to bid, including them. And so we have begun this service with Catholic Charities. We have individuals that are coming through our door, young adults that are being screened by Catholic Charities, that we're identifying their barriers, and then we're beginning to work with them differently through the program. So before you is an amendment to the Catholic Charities contract, adding $977,000. Those funds will be used to hire additional staff. The staff will provide more coaching and case management than we've provided in quite a few years. This staff will mostly serve youth that are between the ages of 16 and 24. The vast majority of them will be 18 to 24. And the service will be much more comprehensive. I'm going to just recognize there's a distinction between what we will do and other counties will do. Most counties will end that service a year after the individual gets placed in a job. That's not our goal. Our goal is to help an individual get a job or get training, but to stay with them, to continue to serve them, and in time to help them get a better job and move forward with their career. So this is, there was a lot of information there. I'd like to pause and see if there are any questions. I am joined by Bob Math. Bob can help me explain the existing programs. And I'd also like to tell you a little bit more about some of the other advantages of this arrangement, but I should pause first to see if there are questions on the information to this point.
Any questions from the committee?
Yes.
Councilman Brown? I'm sorry. Yvonne?
Just one quick question in regards to understanding the 977,000, that's an additional to what it already is? Or
That's
is that the total? And what was the previous I was looking at? I didn't see it.
I'm gonna ask Bob to speak to what the previous contract amount is. I apologize. You got me there.
No, they don't put that important info.
Through the chair, Councilwoman Conwell. The contract, the total value now is, with the amendment, is $1.8 million. Prior to that, it was, the amendment we just issued was $477,000, and it was, we exercised one of the option years to amend this contract. Okay. So this $977,000, since they're co-located, it's 100% for staff.
But it's going to Catholic Charities.
That's correct.
Gotcha.
Down the line, Councilman Miller.
Mr. Chairman, Director, is the need for additional staff due to serving more people or for providing more services or both?
It is principally providing better services, more than more services. There is what I intended to explain in the next part is we will be providing this service on site at JFS in cooperation with Ohio Means Jobs. We are going to invite their staff to sit in our building, and we will jointly serve individuals coming through our programs to better utilize resources in both programs. At the same time, Catholic Charities and Cauga Job and Family Service staff will be setting up offices in Ohio Means Jobs so we can reciprocate the cooperation. And the services will be much more in depth.
And the part about the longitudinal case management where you're not going to just help them get the first job, but you're going to follow them over an extended length of time. This sounds like the county executive's new workforce development program. Is this the executive's program, or is this a related application of the same principle, but it's not being funded with the money that we put in for the executive's program?
This is the executive's new program. And so the key distinction, and please excuse the very brief history reference here, Back in 2015, I was asked to participate in a governor's task force to reduce dependence on public assistance. The name says it all. The goal was to reduce dependence on public assistance, not to pull people out of poverty. And so that task force created a framework that said we should serve people longer. Frequently, families don't move out of poverty in a 3-year time frame provided by cash assistance with the specific compliance requirements of cash assistance, and we should be more flexible and comprehensive. And so it was out of that task force that the early ideas of this came together. Unfortunately, the structure of the state's program and proposal is assistance will be provided to someone with the goal of getting them a job, but any sort of job will most likely end a family's ability to draw cash assistance and thereby end the relationship. So our intent is to use some of the additional resources provided by council through the county executive to maintain that relationship so that if a person comes to us and we help them get a job, I actually heard about this from a mother of a client recently. Someone came through us, they were immediately referred to Walmart. They got a job at Walmart, and we're grateful for the opportunity of employment. They then went on to a plasma bank. They're at an income where they can no longer get benefits, and they really want to become an STNA, and they don't know how to become an STNA. And so what we want to do is we want to have case managers available to go back to that person beyond cash assistance and to walk them through the process to become an STNA, and as well as fund the STNA training, because that's what the person wants to do. And so the county executive's dollars will in some way support the longitudinal approach of this program.
Well, 21 years ago when we passed what was called welfare reform at the federal level, we solved one set of problems and created a whole new set of problems. And hopefully now it's been a long time, but hopefully now we're starting to clean up some of those problems and come up with something that might actually work. So I wish you the best of success.
Councilman, I just want to say that the individual that I was talking to, the mother, is an employee of ours, and she came to us as a client in welfare reform. And she said she was receiving benefits, and I don't think there should be any shame in that, but she was receiving benefits, and a case manager said to her, "What are you going to do? What's your plan? What are you going to do? Where are you going to work? Why don't you apply for a job at the county?" So this person started as at the lowest level, became an eligibility specialist, became a supervisor, and is advancing through our organization. But it's important to recognize that her child then came to us as an adult with her own children. And that child has now received our services, but landed at Walmart. And that's how far we got the child, and then we bid her adieu. And I feel like we can do better. And I think the way we will do better is through a real strong relationship and access to resources.
Okay, go for it.
Any further questions? Councilwoman?
Mr. Meerman, I just wanted to be clear. This was a no bid, right?
This was an amendment to a contract, yes.
Okay. And
I'm sorry, the contract was procured. Bob reminds me that we did procure Catholic Charities through a competitive procurement process in 2015.
okay. Because you mentioned the rebid, and then I wasn't really sure how that would work. So when we do the procurement in the future with them having their contract amended, do we anticipate, I guess, consulting with them to design how does that work?
Sure. I do think, so we don't consult with our providers when we design an RFP, but, clearly Catholic Charities has been doing this service for a little while. I'm just going to be honest, we haven't done this in this way before. We've done intensive case management and we've done screening, but we've done that specific to a barrier to maintaining participation in a program. And so we are taking this first year almost like a pilot or like a ramp-up year. We're gonna try things, we're gonna work differently, we're gonna be aggressive. And at the end of it, we will have a better sense on how this service should work moving forward. We will design the procurement. We will not talk to Catholic Charities about the design of that procurement. And they and any other provider in this community will have the opportunity to apply.
And It's not strictly for the disabled. You said ages 16 to 24, with the majority being ages 18 to 24. I just wanted to verify because I'm reading it.
Yeah.
It says Ohio Works First in Disability Financial Assistance, and I might be just misinterpreting the language there.
Yeah,
so-
that's an artful expression. That's probably a mistake to include the disability financial assistance in it. There was maybe some draftsman error in that. It is relevant to say Ohio Works First, but they serve much more than that.
Dave, take a moment and just briefly, share with us the executive's vision for workforce development.
Sure.
We've discussed this, but I know he has 3 major initiatives, but just briefly describe his vision.
This is most significantly focused on the first of the initiatives within workforce, which is to help individuals that are receiving benefits and assistance from the county to get into a career path. So the best way for me to describe it, Armin came to our office, met a young man. Armin walked up to him and said, "What are you here for?" The guy said, "I'm here to find a job." His parole officer said he's here for SNAP. And then we gave him SNAP and he moved on with his life. And so Armin's vision is that when a person comes to us and they say, "I want a job, I want a career," we can give him that. When we do that, I don't want to say that that's not something that never happens. It does happen, but Armin's saying it has to happen more and with better outcomes in mind. So the goal here is that every person, when they come through our door, they have an opportunity to be assessed so that we understand what barriers they're dealing with, and they have access to resources that will connect them to either training, education, or direct placement if they already have the training and education, so they can get a job. But getting a job is not the end, it's a step. The next step is to have a job that pays a better wage or advances their career. So a person may come to us, in the example I gave of the young woman, she came through us, we placed her at Walmart, she moved on. We want her back at some point. We need her to come back and to get her STNA training. So what ARM is proposing is we have to re-engage participants or maintain our engagement beyond the standard 3-year time frame that we tend to think about with cash assistance, and to be flexible. It's not a cookie cutter approach. You can't treat every person the same way. You have to have individualized services. And so ARM is saying we will contract for coaches, and we will contract for post-placement services. And so when we find a person, we assess them, we give them the case management, we give them the resources to address the barrier, we place them, but then we come back to them. The post-placement is essential. We don't lose them, we stay with them and understand either what's working in that placement, or if it doesn't, why it hasn't worked, so we can get another placement. But even then, not to step away, to stay with that person until they're at a job that pays them a wage that does not require county support or federal support. And so the simple way to outline this is a stair step. Generally speaking, we're talking now about the first step in a stair step. It's a person coming to us, probably receiving food assistance, something happened in their life that they then need cash assistance. They're 18 to 24 years old. We are saying to them, we think you have tremendous potential. You need to tell us what your barriers are to having you come get cash as opposed to a job, because we want to address them. If the barriers are education and training, we're going to provide education and training. If the barriers are placement, we're going to provide placement. And we're going to give them a coach or a case manager to help them through that entire process as long as possible.
Okay. Thank you. Are there any further questions? If not, I'll make a motion that we move this resolution to the full council.
I would request second reading suspension once again. I take responsibility. This is late. There was a protracted review as to who we would contract with and how, and this is a service that we feel should have been able to be provided out of our existing contract, but we want to keep the scopes separate.
Under second reading suspension. Again, seconded, moved and seconded. All in favor, say aye. Aye. Ayes have it. Thank you.
Thank you very much for your consideration on this.
All right.
I have a no on that.
Oh, yeah, no.
No.
Okay. Should we do it again as a roll call?
did you want to,
I'd like to clarify with the roll call.
okay, calling the roll on resolution 2016-0163. Mr. Jones?
Yes.
Ms. Conwell?
No.
Ms. Brown?
Yes.
Mr. Miller? Motion carries.
At this moment, I would like to bring forward Mr. Adam Jacobs. Would like to have the presentation.
Mr. Jones, did you want to read the final item of legislation before the presentation?
Well, let me ask, are we under time constraint? Is it? Oh. If it's okay. All right. Okay. And again, Mr. Jacobs, thank you for coming. Please take a moment to introduce yourself onto the record.
My name is Adam Jacobs. Some of you know me as the president of Belfair, and others of you know me as the president of the Wingspan Care Group. I serve in both roles. Thank you for having me today. I'm here at the request of your staff, who asked me to speak a little bit about the changes that are going on with Medicaid, particularly how they impact children and how they would impact this county. So with that, that should suffice as an introduction, yes?
Yes, that's it. And I'll just add to your comments. In this committee, since I've been chair, I've tried to invite those in the community and the Health and Human Service world to come and share with us so that we get a sense of what's going on and just to engage each and every person. So we thank you for responding to our request, and we look forward to hearing your presentation.
Well, I'm flattered to be here, flattered to be asked, and hopefully enlightening. As you know, Medicaid serves many different populations. It serves the aged, blind, and disabled. It serves poor people, and in particular, in a bit, I'm going to speak about how Medicaid is a service for those children in the custody of the county DCFS, in the custody of the courts, and also many of the children go to our municipal schools, Cleveland Municipal School District and the entering suburban school districts. So to back up for a moment, if, say, Councilman Miller is on Medicaid and he needed an appendectomy tomorrow, he would go to the, not wishing that on you. All right, I'll pick on Councilman Conwell next. So if Councilman Miller needs an appendectomy, he say he goes to UH or the Cleveland Clinic, and they have a contract with the largest managed care company in this county, which is CareSource. He gets his appendectomy performed, and the clinic or UH get reimbursed by CareSource for whatever their negotiated contract is. That's on the Fiscal Health side. To share the pain, if Councilwoman Conwell needs counseling, because she's sitting next to Councilman Miller, if she needs counseling, she has two choices. One, she could go to a private therapist, say a therapist on Sugar Boulevard, and that therapist would likely get reimbursed something to the tune of $45 to $60 for that unit of counseling. On the other hand, if she went to a place that's an established community mental health center, whether it's Belfair, Murders Taylor, let's say Catholic Charities, they would get reimbursed $90. And the reason for that difference is because on the behavioral health side for the counseling, the private practitioners don't want Medicaid clients in their offices. Another reason is that many of these clients you have to have outreach to, go into their homes to deliver the service, and they're not willing to do that. And there are all these regulatory hoops to become a community mental health center. So that's why the difference. And in that latter case, it's called the Medicaid carve-out. It's not like the rest of Medicaid. It's carved out, and there are sort of two parallel ways of doing this. Well, that carve-out is getting carved in. and it's now going to become managed care. So here's the reason why we collectively should care about that. All the children in the Department of Children and Family Services, their counseling is getting done by community mental health centers, as are many of the kids in juvenile court. So here's the way it works today. I'm going to give you two instances. One of a child who's being seen in the Cleveland Public Schools, and the second instance is somebody who's in residential care, a child. After I give you these examples, I'm going to then speak about the economic impact upon this county and upon the Cleveland Public School District in the first-ring suburbs. So, when Tom Pristow refers a kid to, say, Ohio Guidestone or Belfair, he pays a daily rate, and that daily rate covers the cost of the kid living there, to put it in slang, 3 hots and a cot, and the therapeutic milieu. The actual treatment, the counseling session, gets paid for by the carve-out Medicaid, which doesn't cost the county anything. In the Cleveland Public Schools, there are literally hundreds of counselors from the community mental health centers, Murs Taylor, Belfair, Palmerdale, Cleveland Christian Home, providing counseling in the schools because the teachers, the vice principals all refer for that counseling. And what's great is the treatment in foster care, the treatment in residential settings, the treatment in the schools are not costing the schools any money, not costing the county any money, not costing juvenile court any money. And it prevents these kids in the schools from spiraling out of control and then ending up in the county system or in the justice system. And it keeps kids on a collision course with the system from not colliding. In residential treatment and in foster care, it helps see through their treatment so they can be returned home quicker, sooner, faster. Well, once it gets carved in, the managed care companies are in it to make money. Their medical loss ratio by contract is 85%. The state in the Medicaid redesign is already lowering the rates for reimbursement. And so all these mental health, community mental health centers are going to turn to the courts, to protective services, and say, hey, we can't provide the treatment. I'll give you specific examples if you want, but they're going to eventually turn to the counties, not just this county, it could be Hamilton County, Franklin County. They'll turn to the county children's service boards, DCFS, and say, you have to pay for the treatment. So it's a shifting of cost downward, much like we saw when I forgot what it was called, municipal revenue sharing was changed. So we're going to be experiencing a shifting of cost downward onto local counties. Worse in the school, or just as bad in the schools, what we might see is that kids don't get the service they need because the managed care company says, well, this kid is, I got a little problem here. You could do a few sessions, but all this after-school programming and all this in-school counseling, well, they don't need it. So now you're going to see kids who were on a collision course and got diverted actually have a collision. And the average daily attendance in the school goes down because they're not getting the service. And instead of paying less money now, we'll pay more money later, except that more money will come from not the pocket of the state, but it'll come from the pocket, not the pocket of the managed care company, but it'll be from the pocket of the counties, the courts, the schools. So that's sort of the treetop overview, and I probably should shut up for a minute and just entertain questions.
Will the number of children receiving treatment decrease as a result of the
Well, it's
changes?
all, my guess is eventually yes. We all have insurance, and how many times have you had an insurance company say, well, this is not it's not medically necessary. This is how managed care companies make their money, right? Now, if if I could flip over, if I was a managed care company, I would say, no, this is not true. We're going to improve service. Service is going to be pegged to outcomes. We're going to be able to integrate the physical health care with the behavioral health care. And so if you had somebody from the managed care company, you would be hearing a much different tune, right? So I'm trying to be a little bit even-handed here. But given the way managed care companies are basically insurance companies, and if you have a medical loss ratio of 85%, you could kind of take it from there, right?
Okay. Any questions from the committee? Sure. Councilman Miller?
I'm not a medical payment system guru. What does this medical loss ratio business mean?
So if they get $1 from this state to provide the service to take care of the population, or if they get $8 million from the state to provide services to a population of people, they have to spend 85% of that by law on services. The other 15% could go into their pocket for whatever.
And when you started out, you explained this two-tier payment system. Could you kind of explain that again?
Okay.
I didn't understand it very well the first time, but I think if you explain it again, I think in the context of everything that you said thereafter, that it'll be more clear.
It's my New York accent. It just gets in the way.
It has nothing to do with that.
All right. So let's go back to fiscal health care. If you're on Medicaid, your fiscal health care is paid for by the managed care company. They have a contract with a physical health care provider to do that. If you go to a private provider without a contract with a managed care company, that private provider is not going to get reimbursed. So tonsillectomy, appendectomy. On the behavioral health side, where you need counseling, it's a bifurcated system. You could go to a private practitioner who does not have a contract to be a community mental health provider, and that provider would get $45 if they're a social worker for the unit of counseling. If you go to a community mental health center like Murders Taylor or Belfair or Applewood, that provider currently receives $90 for that same unit.
So you're saying that the public agencies are getting more than the private agencies?
Yes.
That's surprising.
Well, the reason why is the private providers aren't going to outreach to this population, don't want this population necessarily in their offices, don't go into the homes. You don't see private providers going into the schools, Cleveland Public School District, to provide services.
So you're saying they're only going to get $45 an hour, but they're not going to serve very many?
Right. They're going to shy away from that service.
Mm-hmm.
And not give the depth of service that, or the range of service, since they're not physically going to someone's home. Or,
Right. So I'll just use Belfair as an example. We have about 30 counselors that actually go into the homes of people and provide the service. So this bifurcation has existed for, I've lived in Ohio for about 20 years, 25 years. So it's existed for at least 25 years.
So when they bifurcated, Mr. Chairman, to Mr. Jacobs, what do you think your new rate is going to be?
Well, there are I don't want to get too wonkish on you, but there are 4 components to the Medicaid redesign at the state level. The first is rates. The second is what services will be on the menu permitted to be delivered. The third is benefit limits. That is, how many sessions of any service you could receive. And the fourth is who is eligible to receive those services. So I don't know, I focused on rates because it was the easiest way to tell the story. But they're, in the Medicaid redesign, they're going to look at all four components. So it's unclear right now whether it'll just be rates, eligibility, what services will be delivered, or the benefit limits. And that's sort of the back and forth that's going on at the state right now. To the extent that either A, rates get lowered, eligibility becomes more difficult, benefit limits are lowered, or the range of available services are diminished, that will all impact the county. I just use rates to be illustrative. I don't know what the answer is to that specific question.
Okay. Any further questions? All right, please continue.
Thank you for having me.
All right. Thank you. Thank you. At this time, Chrissy, if you would read our next and final resolution.
Resolution 2016-0164, authorizing a contract with the Salvation Army in the amount not to exceed $527,499 for the past transitional housing program in connection with the fiscal year 2015 Continuum of Care Homeless Assistance Grant Programs in the Hearth Act for the period 10/1/2016 through 9/30/2017.
Director.
Good afternoon, Ruth Gillette, Office of Homeless Services. I'm here to represent the contract with the Salvation Army for the PASS program, and I've given each of you kind of an information sheet about the program and what services are provided. It's a 75-bed program. The clients are all referred from 2100 Lakeside, so they're literally homeless. Over a year, the program in 2015 served 207 individuals. The average length of stay is a 6-month period, so some are less than that. 52% of those who leave exit with cash benefits, and that would either be employment or they've achieved Medicaid funding or other benefits, cash benefits that they are eligible for. 90% of those who leave exit with non-cash benefits, which would include food stamps and ability to access medical care. 76% exit to permanent housing. And they, while during the time that they're part of the PASS program, they are assisted to gain employment so that they will be able to sustain themselves in permanent housing once they leave. So I'm happy. It's 100% funded through a federal grant through the Continuum of Care Homeless Assistance application process. And Bo Hill, who is the director of Harbor Light, was here to answer questions, but he had another meeting at 2:00, so he had to leave. And so, he sends his regrets, but I'd be happy to answer any questions.
With the executive's workforce development plan, as you heard a little earlier, does your work here and the component of attaining employment for the clients, has it been adjusted in any way to align with the vision or?
To the chair, my office has been trying to interface with Job and Family Services much more directly over the past several months, specifically around families and youth. But as well, we will be looking at the single adult population, but particularly with the intensive case management, the comprehensive case management program that Director Meerman was describing, that's targeted to the 18 to 24-year-old population, and with the Ending Youth Homelessness initiative that our community is involved in, we're hoping to have a real sort of alignment there. Also, Job and Family Services is working with the Seattle Jobs Initiative. And again, the thrust from the state level and the federal level is to try to make the employment programs more useful for people with higher barriers. And so that's the population that is in the homeless system, obviously. So we're very interested, and David has outreach to include the office and some of the partners in those meetings with the Seattle group. We have partnered with Job and Family Services and Enterprise Community Partners on a grant application to the O'Neill Foundation that is specifically looking at improving job outcomes for families in shelter. So yes, long answer, but short answer is yes, we are definitely trying to get it together.
Any questions from the committee? Councilman Miller?
What happens to the 24% that don't exit to permanent housing?
Through the chair to Councilman Miller, about 12% of those folks return to shelter. So one of the efforts that's being made is to not screen individuals out of programs. So there aren't really any barriers to people coming into the program, which means that there's a higher rate of people not, doing well the first time maybe, but going back to shelter. And then the other distribution is to temporary housing, maybe with family or friends, that kind of thing.
And it looks like you're trying to take a more whole, comprehensive person approach, and I applaud that.
Thank you.
Any further questions from committee? Councilwoman?
Thank you, Mr. Chair. It says 100% of the referrals come through coordinated entry. Therefore, since we're talking about PASS, I'm thinking that's strictly for the PASS program. So my question essentially is, if someone were homeless, these are all men, right?
Yes.
If someone were homeless and just came into the Salvation Army for a bed, is that an option for them? Do they provide like emergency shelter?
Through the chair to Councilman Brown. So our community has implemented a coordinated entry. And so if someone were to call Salvation Army and say, I want to come to the PASS program, they would say, you have to go to coordinated entry. And so there are more people who would like to be in the PASS program than they have capacity for. And so people would perhaps wait at 2100 Lakeside until there was an opening.
Mm-hmm. Any further questions from the committee?
I don't have any question. I just want to clarify, and I think you touched on it when you responded to Councilwoman Brown's question. So they go from 2100, sometimes 2100, they get into PASS program, and then if they're not one of these percentages, they will probably have to go back.
They would go back, through the chair to Councilman Conwell. So everybody comes into coordinated entry, and if you're a single male, you would be, referred to 2100 Lakeside for immediate shelter if you needed it. And then from 2100, you could be referred to the PASS program, to Y Haven, to Stella Maris, to permanent supportive housing immediately if you had, if you've been homeless for a long time and have severe mental health issues. So that is where people more or less start out.
So my question would be, are we keeping data on, is your department keeping data on those individuals that we can't find another place for, and how it's affecting or impacting their sobriety? Because they're put back into the homeless shelter for whatever reason. Family won't take them back, can't find anything, but I would be interested to know how many slip back to using again, because they're put back in that environment, which is kind of depressing.
To the chair, to Councilman Conwell. So when I was saying that there weren't any barriers for people to come to pass, used to be that the men's transitional programs screened people out. They would do drug tests before letting people in. The Department of Housing and Urban Development has said there shouldn't be barriers to people coming into programs that we fund. And so, so they are taking people who want to become sober and want to, and they have the opportunity at the Harbor Light to engage in intensive outpatient because Harbor Light runs a number of AOD programs, and they have a detox program, for example. However, if someone slips back, even if they slip back, the incentive is to not immediately discharge them, but to give them another chance. So, but eventually, if someone is using, it becomes a problem for the other people in the program who are trying to pursue a sober lifestyle. And so they will be referred back, they can go back to 2100. We're trying to work out an agreement between the 3 programs that serve men with addiction issues, which would be Y Haven, the Salvation Army, and Stella Maris, so that when one of the people in their program has a relapse, that instead of going back to 2100, they can go to one of the other programs. And again, it's to your point to just try to at least maintain, some level of programmatic, support. So there is an understanding about the relapse, and yet it has to be balanced with the rest of the community that's trying to maintain sobriety.
Thank you.
Any further questions? If there are no further questions, I'll make a motion that we move this resolution to the full council. Moved and seconded. All in favor say aye. Aye. Ayes have it. All right,
Thank you.
you.
Could this be passed on
Second
second reading? Okay,
Agree. And we
Thank
will
you.
do under second reading.
thanks very much.
Okay, you're welcome. And yes, again, I make a motion that we move this to the full council under second reading suspension.
Second.
We will withdraw.
Mr. Jones, you made the first motion and Mr. Miller made the second.
I made all. So the motion and the second have been withdrawn. I make a new motion that we move this to the full council under second reading suspension.
Second.
Moved to second by Councilwoman Conwell. All in favor say aye.
Aye.
Ayes have it. All right, is there any miscellaneous business? Chrissy, has anyone signed in for public comment?
Yes, Mr. Chair, Ms. Liu.
Ms. Liu, please come forward.
Good afternoon. I'm very glad to be here again because today I heard 2 things which are I think, very promising, especially to homeless youth and the general homeless population. Currently, the people staying in the women's shelter, which is supposed to be single adults, but right now we still have all the families are there because the situation has not been any better. Even the school already started. You can see how much struggle they have to go through because some of them do have the kids at school age already. Not all of them are little babies. And that really creates a lot of strength. Fortunately, shelter currently do have some good staff who will try to take care of that, but shelter itself, the staff or the food or everything is still very limited. That does create some other issues, some other problems. Still, it's not getting any better. This is one thing I would like to address so you will know the most updated situation. Second one, Homeless Congress already made this decision in the meeting they just had. They think the women's shelter service provider should be changed. The deadline was to this year, September, and President Brady's already acknowledged that. And up to now, all the efforts to put on, you don't really see enough efforts to put on the targeted problems. So all the people staying there still don't see any changes, positive changes for them. On the other hand, one of the presentation, for example, really intrigued me because lots of people currently stay in the shelter, they do have a behavior issues, which they may not know that they can have certain things to help them on that. They just feel totally stressed out, totally helpless, and nothing is working for them. But they don't know there's things like that which can help them. So the situation for their management, if they cannot really get rid of all the bad staff, it will not go any better. Thirdly, we welcome Councilor Conwell coming to the voter registration event at Cosgrove next week. And I myself, at least I know, I'm looking forward to seeing you there and to listen to your speech. Thank you very much.
Chris, is anyone else signed in for public comment?
No, Mr. Chair.
That's it. All right. All right, if there's nothing else that holds our attention, our meeting is adjourned.